شباب استريحوا. Last but not the least lecture about the headache. The headache is very common symptoms, as you know, and it is very important symptom. It could be the presentation of many problems, and the presentation could be from a serious problem to a very mild problem. And your duty is to differentiate between the serious and the mild. Because if you miss a patient with headache and turn to be serious problem, like for example, meningitis or encephalitis, that will be a problem to you and a problem to the patient. I know that شباب خليكم معي. I know that in certain conditions أطباء بعض الأحيان يكونوا مضغوطين بالطوارئ أو بالعيادات، ويشوف يمكن الطبيب إذا كان overnight on call يمكن يشوفون 30 مريض من هيدك. يمكن دولة 30 مريض من هيدك 1 or 2 are serious، لكن إذا شافهم كلهم and he missed the serious problem ثاني يوم will not be thankful، ما راح يشكروا إنه شاف 30 مريض، راح يقولوا كيف إنه you miss a serious problem. Now during this lecture we'll highlight certain points in the headache and certain point to differentiate variety and types of the headache. Now, to start with, now why somebody got a headache? Now, headache is not uncommon symptoms. It is about 1 to 2% of emergency department, casualty department, and even about 4% of medical office consultation, outpatient. Now, where we got a headache? The headache is the result from, number 1, traction, caused by traction, or displacement, or inflammation, or distension of the pain-sensitive structures. Pain-sensitive structures in the head and neck. That's why we got the headache. Now, the intracranial pain-sensitive structures are many. For example, the venous sinuses or meningeal arteries or the dura mater, especially at the base of the skull, or the trigeminal nerve, as you know, or certain large artery like the internal carotid artery, and so on. These are pain sensitive. Now, in the classification of the headache, we classified headache into 2 main categories. Number one, we have the primary headache and we have the secondary headache. And we have examples for each. The primary headache, like migraine or tension type of headache, or cluster headache. هنتكلم عليه in detail each one. Or sometimes trigeminal neuralgia or chronic daily headache. It's a primary type of headache. The secondary, from the name, secondary to a secondary cause. And these are like a headache called referred headache. Referred headache means that the pain is referred from nearby structures. For example, eye problem. A lot of patients who have headache, then they check their eye for vision, and they found they have problem with the vision. Or nose, nasal problem, sinus problem. Or cervical spine, especially in elderly. They have cervical problem leading to the chronic muscular contractions of the neck muscle, leading to the pain and headache. We have a special entity of headache called medication overuse, rebound headache. هذا راح نتكلم عليه in detail. Trauma, طبعا should not forget trauma to the head and neck. Trauma is very, very important. Vascular disorder like subarachnoid hemorrhage and AVM. Vasculitis is very important part, like inflammation of the temporal artery, temporal arteritis. We'll talk about it in detail. Changes in the intracranial pressure, either high or low. Intracranial pressure also occurs in headache. Cerebral tumor, هتاخدوها بالنيوروسيرجري. An infection, أخذناه إنه الانفكشن meningitis or encephalitis. So infection either of the CNS or systemic infection. Systemic infection, other infection. Okay. We start with the vasculitis or temporal arteritis. Now this is old lady and have the headache because of temporal arteritis. Now the temporal artery, this is the temporal artery, and this is inflamed temporal artery. And the symptoms of temporal arteritis include headache, as usual, headache, plus generalized fatigue and tiredness, because it's one of the connective tissue disorders, sometimes associated with fever, and if not diagnosed early, there might be complication like visual loss. Complication of the visual loss. Why? Because some of the arteries goes to the eye, and this could be involved. Now, the patient with giant cell arteritis or temporal arteritis, they are classified. Patient should have a giant cell arteritis or temporal arteritis if at least three out of 5 criteria. 3 out of 5. شو هي هاي؟ Number 1 criteria, the age. Usually the age of the patient 50 and above. Number 2 is a new headache. ما كان عنده headache سابقا. New headache. Number 3, temporal artery abnormality. When you palpate the temporal area, you find that there is a thread-like palpation of the temporal artery. This indicates inflamed temporal artery and thickened temporal artery. Also, by investigation, there is raised in the erythrosedimentation rate, ESR, more than 50. And finally, five, if we like to prove it 100%, we take an artery biopsy. And the artery biopsy specimen showed signs of vasculitis. And, and the vasculitis, inflammation of the vessel wall with the invasions of the mononuclear cell infiltration and granulomatous formation with multi-nucleated giant cells. إذن ثلاثة من هذول enough to diagnose giant cell arthritis. Now this is a diagram about the blood vessel there. Blood vessel. Now this is the internal carotid, temporal artery, and these are the branches. Some of the branches go to the eye, some of the branches go to the lingual area. So temporal arteritis or granulomatous arthritis the artery affected could be the aorta and it's a branch, external carotid artery. The external carotid artery. This is the carotid and the external carotid arteries. Now there are certain signs and include for example, the superficial temporal artery. You palpate it, you can feel superficial temporal artery. Or there are positive signs of systemic inflammation, like fatigue, fever, and weight loss. It is most commonly affecting female women 50, 55, and above. It is associated with other arthritic problems like polymyalgia rheumatica. polymyalgia rheumatica تاخذوه بعدين بالروماتولوجي انه rheumatism, inflammations of the joints and affect multiple joints from joint to the other because it's connective tissue. And sometimes this could be lead to complications like aortic aneurysm, stroke, or blindness. Why blindness? Because the branch of the blood vessels goes to the eye, and that leads to optic atrophy. Sometimes the lingual artery is affected, leading to some sort of ulcers in the mouth. So the giant cell arteritis caused by inflammation of this artery and typical affecting age between 50 and above and causing the pain, jaw pain, and vision problem. It is closely related to the polymyalgia rheumatica. This is the temporal artery, and this is the branch of the ophthalmic artery. So if the ophthalmic artery involved, this leads to the ischemia in the retina and lead to optic atrophy and lead to blindness if not diagnosed early. If the facial artery is involved, lingual artery involved, that lead to ulcers at the tongue. Okay, so this is the temporal artery. Now you see the patient, and you see this is the signs of temporal artery. It is very abnormal temporal artery, thread-like. When you palpate it, it's thread-like. As we said, because it affects the ophthalmic artery to ischemia, and that leads to the optic tract, optic atrophy, optic disc atrophy, and that leads to blindness. So we have general principle. If you're suspecting patient with temporal arthritis, you have to have urgent referral to the hospital, rheumatologist or physicians. Now, if visual symptoms appear, the referral should be at the same day, very urgent, at the same day. And ophthalmology review should be done. And immediately you give a dose of steroids. So the management of the patient without visual symptoms, then you give a dose of 40 to 60 milligram prednisolone per day. If the patient have visual loss, you have to give IV 500 milligram methylprednisolone for 3 to 4 days, followed by oral prednisolone. So it is one of the emergency. So temporal arthritis, it is an emergency. دائما من يجي عندك مريض headache يصير عندك فد هبت انه you palpate. اذا قال لك والله انا عندي unilateral headache، بعدين هسه راح ناخذ signs red flag in headache. شو هي الريد flag in headache؟ راح نشوفها. فدائما palpate the temporal side. If there is temporal artery abnormality, think of temporal arthritis. Don't miss. Okay. Now the headache are of many causes, and sometimes the location of the headache give you a clue to the possible cause. For example, the headache could be due to sinuses, frontal sinus, maxillary sinus, and usually the pain is behind the brow bone and cheekbone. هنا وهنا. This is the sinuses. On the other hand, the cluster headache راح ناخذه بآخر المحاضرة. يكون pain is in and around the eye. Around the eye. On the other hand, the tension headache, the pain is like band-like squeezing of the head. On the other hand, the migraine, the pain could be associated with nausea and visual changes, and typically classically on one side. راح ناخذ each one and we discuss it. But before that we have called red flag in headache. دائما واحد هاي يتذكرها، حتى لو يقدر يخليها على ورقة يطبعها ويخليها بجيبة المريول. دائما من يجيك واحد هدك تشوف is it one of the red flag. شو هي red flag in headache? Which is very important. Number one, the patient يجي يقول لك this is the worst headache of my life. The worst headache of my life. This is red flag. Or patient يقول لك this is new onset headache. أنا ما كان عندي headache. هذا لأول مرة يصير new onset headache. Or there is change in the character of the old headache. Change in the character of the old headache. Or the headache awakened the patient from sleep. This is a red flag. or headache associated with focal symptoms and fever, or the headache is worsening with bending, lying down, coughing or sneezing, and headache in a patient who is immunocompromised. هذول immunocompromised, low immunity, they are liable to have infection. And finally, cancer patient. Cancer patient that are under headache, you have to be very careful. You might have secondary in the brain. So these are very important. They call it red flag of headache. Now examination always دائما نشوف بالعيادات المحترمة في ophthalmoscope. دائما يكون patient headache, try to look through his fundus, because examination of the fundus, it is a normal like this, pinkish color, nice margin, normal, optic cup, clear blood vessel. Like sometimes the optic examination is not normal. For example, in this patient, which is early of papilledema, the margin is blurred, and the disc is congested and red, and the blood vessels are congested. In severe cases, now totally the disc is blurred, and there are a lot of hemorrhages, dot and blood, and exudate, white exudate, especially in diabetic or hypertensive retinopathy. So fundoscopy is important. نجي على البرايمري headache, migraine. To diagnose migraine, we have to have the following, وهاي مهمة، هاي تنحفظ. Number one, that the prevalence of the migraine about 12%, high. And more than 90%, majority are young, before the age of 40. And usually, we have two types of migraine. Either migraine, it start with visual or other neurological symptoms, تقريبا 15 to 20%. This is called migraine with aura, or classical migraine. ليش يصير migraine with aura? Simple. لأنه pathophysiology of the migraine is due to vascular abnormality. شو يصير? We have two stages. The first stage is vasoconstriction, and the second stage is vasodilation. In the stage of vasoconstriction, there will be relative ischemia. That's why the patient could have ophthalmic features, eye features. For example, the patient have visual abnormality, zigzag movement in front of the one or both eyes, and sometimes blurring of the vision. والمريض هو بيعرفها دول الكلاسيكال migraine. قبل لا يبدي الهدف، قبل لا يبدي الوجع, he starts to have visual problem, zigzag movement, blurring, wavy shape in front of his eye, one or two eyes. And this is usually called migraine with aura or classical migraine, اللي هي تقريبا 15 إلى 20%. The second type is most cases الباقين without aura, no aura exists. And this is called migraine without aura, أو يسموها common migraine لأنه هو common أكثر صاير، هو 80%. What are the features of migraine in general. Now, this is the diagnostic criteria. مهم. The diagnostic criteria, A criteria, a headache. The patient have attacks of headache, at least 5 attacks. 5 attacks fulfilling B to D. من B إلى D. شو هي البي to D؟ B البي هو headache attack lasting from 4 to 72 hours. هاي duration. Untreated or unsuccessfully treated. هاي duration. هذا واحد. B. C the headache وهي مهمة جدا. The headache has at least two of the following. Two of the following. شو هي الفولوينج؟ Number one, unilateral location. Unilateral location. Number two, pulsating quality لأنه vascular headache. Pulsating throbbing quality. C, moderate to severe pain intensity. And number four, it is aggravated, so there is aggravation by or causing avoidance of routine physical work or physical activity like walking, climbing stairs. إذن الكرايتيريا هو عندنا 5 أتاك وكل أتاك بها كرايتيريا من B إلى D. البي هو الديوريشن between 4 to 72. الهيديك has one of the following character, two حقيقة of the following character, unilateral, pulsating, moderate to severe, aggravated by walking or climbing. D, during the headache, at least one of the following. You could have nausea or vomiting, كثير من الناس صرتهم nausea and vomiting, photophobia and phonophobia. Photophobia and phonophobia. And E is not attributed to other cause. إذن ها هي الكرايتيريا مال المايجرين. هاي تنحفظ تجي على شكل multiple choice. How we management? Management depends on the severity and the frequency. If the headache becoming too frequent, يعني مرة بالأسبوع 3 مرات بالشهر, هنا it will interfere with the usual activity. هنا نعطي prophylaxis. And the prophylaxis either beta blocker daily, propanolol, small dose, or sometimes Topamax, which is one of the anticonvulsant, daily. Or sometimes we use antidepressant and amitriptyline. هذا يقلل الفريكونسي. أما during the attack فهو كالآتي. المرضى بيعرفوا. The patient should go to have a rest, preferably in a dark room. لأنه عنده photosensitivity. Okay, so he go to have a rest, sleep in a dark room, and taking abortive drugs like analgesic drug, brufen. But sometimes not enough. You might add some triptyline, some streptan, or ergot preparation. Ergot preparation. This is for the acute attack. إذن عندنا for prophylaxis وعندنا for the acute. Now, this migraine should be differentiated from another headache called tension headache. التنشن headache ليش سموه tension headache؟ لأن الحقيقة الميكانيزم of the tension headache, patients who have anxiety, tension, whatever it is, they have muscle contractions, chronic muscle spasm and contractions. And that includes the scalp muscle around the head. So the scalp muscle around the head is always tense. كأنه واحد شاد راسه شيء. فيحس انه band like pain around the head. That's why called tension headache. To diagnose tension headache, we have the following character. A, at least 10 episodes. 10 episodes. كان بالمايجرين again. fulfilling from B to D. شو هي البي to D؟ البي headache lasting from minutes 30 minutes up to 7 days. أما يكون كلش قصيرة in minutes بعض الأحيان تطول 7 days. Her duration. C, the headache has at least two of the following. شو هي two of the following? Number one, bilateral location on both sides. Two, mild to moderate intensity. Okay? يقولون عليها may inhibit but does not prohibit activity. يعني يزعج الشغل بس ما يوقف الشغل، يحس نفسه ما مرتاح بس يروح للدوام عادي ويجي الجامعة عادي، يكون ما مرتاح بس ما يوقف شغله not prohibit. So mild to moderate. And number three, which is very important, pressing in character. And the pressing in character that lead to tightening around the head. And it is non-pulsatile. هذا الفرق بينه وبين المايجرين. And there is no aggravation or aggravating factor like climbing the stairs or walking or similar routine physical. And D, both of the following: no nausea or vomiting, sometimes anorexia, no more than one photophobia, ما في photophobia or phonophobia. And E, not attributed to another cause. And usually the management will treat the underlying cause of tension. You have to treat the tension. So the tension headache will getting milder and milder. We have a special type of headache called cluster headache. انتبهوا زين هذا cluster headache. The cluster headache has the following character. At least 5 attacks fulfilling B to D. So إذا عندنا 5 attacks B to D. The B severe or very severe unilateral orbital at the orbit or supraorbital and sometimes temporal pain. Then in the eye, around the eye, even temporal pain. And the duration lasting from 15 minutes to 150 and بين ربع ساعة إلى 3 ساعات if not treated. C وهاي المهمة, the headache accompanied by at least one of the following. شو هي؟ 1. Ipsilateral conjunctival congestion or injection and lacrimation. يصير عين حمراء واللacrimation. هذا يكون ipsilateral on the same side of the headache. 2. Ipsilateral nasal congestions and rhinorrhea. 3. Ipsilateral forehead and facial sweating. And 5. Ipsilateral meiosis contraction and sometimes ptosis. and see there's a sense of restlessness and agitation. البيشنت يكون restless and agitated. وتشوفون هذا المريض unilateral, orbital, supraorbital or temporal pain. ولو تروح شيء تقرب عليه تشوف انه there is many things like the following. The red conjunctiva. The conjunctiva is very red, congested. And the pupil is small and tearing, a lot of tear. Nasal congestion and rhinorrhea. So discharge and congestion of the nose. This is cluster headache. ليه سموه cluster headache? Because it comes on the cluster. Look, this is the headache. So the clinical features are the following. Predominantly common more in male than female. 2, severe or very severe pain. 3, duration between 15 to 180 minutes. And usually it's a clustering. Clustering means come in a group. تجي باليوم مرة مرتين أو يمكن أقل كل يومين ثلاثة، بس تجي على شكل كلاستر، يسموه كلاستر هيديك. فقد تكون مرة باليوم إلى 10 مرات باليوم. Unilateral pain اللي هو بالأوربيتال supraorbital temporal area. وقلنا الهيديك is accompanied by هاي هي اللي حكينا عليها نفس الشيء ipsilateral tearing, ipsilateral nasal congestion, ipsilateral eyelid swelling, ipsilateral forehead and facial sweating, ipsilateral myositis and restlessness. The attack frequency قلنا from 1 every day to 8 or 10 per day. Not attributed to other cause. طبعا treatment of the acute attack rest and we use the drug samtriptan is very important. And the prevention is by using a drug like gabapentin. Okay. نجي على entity which is very important, and that is the trigeminal neuralgia. Trigeminal neuralgia. Now, from the name, it is related to the trigeminal nerve. Related to the trigeminal nerve. Now, in many conditions and instances, that the root of the trigeminal nerve is in a close relation to a vascular structure. And that vascular structure may compress that root. And so there is microvascular compression leading to the demyelination of the root and causing the disorders. And usually involve the second and the third branch. شوف هذا normally this is trigeminal root branches and this is a blood vessel. Usually there is a space between the blood vessels and the trigeminal root. In the trigeminal neuralgia, this is the root and the blood vessel is coming to the root and pressed to the root and causing degeneration and demyelination and causing the problem. Now, clinically, it is characterized by lightening, like momentarily, about a second, maximum 2 minutes of pain. Momentarily lightening. يقول لك دكتور لمعة. Lightening. كأنه لمعة. وتأشر من بعيد. Never touch it. لأنه touch it will stimulate the attack. تأشر من بعيد. Lightening. And there are trigger zones. in the cheek, nose, mouth, and these trigger zones like touching, the touching, cold, wind, talking, or chewing precipitate the attack. فالمريض يقول no, this is the pain. And usually, but in young patient, if the symptoms are bilateral and there are abnormal signs, you have to exclude MS. So look, this lady, very discomfortable, pain, lightening, شوف بالك صاعقة, lightening pain. Come for a few seconds, maximum 2 minutes. And this is due to the vascular problem. Usually, the treatment is very difficult. لأنه الpain is very resistant to usual analgesic drugs. ياخذ analgesic drug ما بيستفاد كثير. فبعض الأحيان نضيف anticonvulsant like Tigritol, and the value of that it takes the sharpness of the pain. ما يروح البين كله بس يصير dull pain, not very very sharp pain. Sometimes in severe cases we might need to surgical intervention for treatment of trigeminal neuralgia. Finally, we have entity called medication overuse headache. حتى تفهموها زين medication overuse، في ناس عندهم عادة انه ما يبطلوا ما بياخذوا البين كيلر. عند البين كيلر هذا عادي لازم ياخذ يوميا، هيك متعود، يعني جيبته ما تفرغ من البين كيلر. والبين كيلر هي انواع، non steroidal anti-inflammatory، بنادول، باراستامول، or ergot preparation. فدائما يعني اذا بالليل حس انه ما عنده هذا يروح يطلع نص الليل يروح للصيدليه يجيب البين كيلر. They found that those patients who are chronically taking painkiller, the painkiller will become useless. It will not help the patient to get rid of the pain. بالعكس, sometimes if the patient having pain and taking painkiller, the pain is aggravated, the pain is increased. So the medication overuse has the following character. Number 1A, the headache usually أكثر أو أقل من 15 days per month. هذا واحد. Associated with B, regular overuse more than 3 months. Okay? More than 3 months of taking analgesic, taking acute or symptomatic treatment drugs. That's number 2. And also these chronic drugs, like the variety of the drugs, like ergotamine and different type of triptan, opiate sometimes, or combination of analgesia, يعمل cocktail of analgesia medication. وياخذها هاي he takes more than 10 days per month on regular basis for 3 months. And these simple analgesia or combination of analgesia like ergotamine and triptan or opiate in 15 days per month on regular basis for 3 months without overuse. They found that the headache developed or markedly increased or worsening during medication taking. And the management of this is counseling, patient education. You explain to the patient that the problem because of the chronic overuse. They should have gradual reductions of these analgesia until he stop it altogether. Thank you.